Good morning and welcome to the new edition of Dr. Lamba's Awakening Call. We in Canada and especially in Ontario are all the time going gaga over the health system. But as I talked the other day, the much wanted health system is not free. You pay for it and you pay for it through the nose. But then is that enough? Leave the cost aside. Are they efficient? The emergencies, the ERs, emergency rooms, are horrible, devastating, and are in fact breeding grounds of disease, illness, and instead of curing, they make you more ill. As a matter of fact, the moment you enter the hallway of any emergency room, you are aware, and the doctors are aware that it's full of danger, full of infection, full of germs, bacteria. And Ontarians are suffering, not today, not since Doug Ford came into power, but since mid-1990s. If you remember, before that, the condition was not bad. But mid-90s, 94, 95, hospitals across the province reduced their acute bed capacity. And this was because Paul Martin's reduction of the national debts. He had passed on the national debt to the provinces when he was a finance minister in Cretchen's government, and the beds were reduced by 30%. That was the result of his transferring the national debt. 30% reduction in the bed capacity all of a sudden was really a disaster. And it was a matter of balancing the books, pure and simple. There was no regard to the effect that it would have on the citizens, on the patients. When Paul Martin did so, the province said, no. We left to explain the cuts and the promised health care of dividend of improved home care. And health promotion was then the vogue in. They said, okay, we'll give you improved health care. We'll promote health. You don't have to come to the hospital. But never happened. Instead, health care needs of an aging population, growing seniors with their multiple chronic illnesses, with their morbidities, including Alzheimer's and dementia, still needed a hospital bed as much as they ever had, or rather more. But the result was not there. Most hospitals in Ontario exceeded the recognized safe occupancy rate of 85%. And there were cases when Ontario hospitals, as a matter of routine, exceeded 100% bed occupancy rates. I remember. I was hospital, and I was shocked to see some patients lying on the stretcher as if they are on the ward bed, and a couple of them even lying on the floor because they were in acute shortage of beds. That being so, how could you give proper medical care? And most urban hospitals, things were not as bad as the rural hospitals. I went to Fergus, it was pretty good. But conditions in the urban hospitals were really bad. And most urban hospitals routinely have 15 to 20% of their beds available, and they are occupied by the so-called alternate level of care patient. The patients who no longer need the hospitals, but they cannot be discharged because there is no home care available. And there is a lack of nursing homes. So it's a very combined thing. Lack of nursing homes, lack of home care, so the patient doesn't want to leave the hospital. And the doctors also wink at this action, which makes the situation worse. And then, coupled to that, as I said, was the attempt of the patients to go to the ERs for needs which were not emergency. The patients could not recognize the difference between the urgent care and the emergency care. Even minor ailments, they would rush to the hospital and crowd the overcrowded ERs. So, government started an attempt. They said that there is improper overutilization by the patients who can be served by the primary care. Part of it is true, as I said, but it's not the whole truth. It's just a part true. Money has been spent. Shall I say wasted? That's the proper word. Yes. On attempts at diversion of non-urgent patients away from ER. So people try to attempt, and I found this, that only a few cities have urgent care centers as opposed to the emergency care centers. The need is that we should have more urgent care centers along with the emergency care centers so that people can immediately be attended to for their ailments and don't have to wait for the appointment by the family doctor. Now, there's another issue. Bed capacity is one issue, and under the current government's plan is not satisfactory addressed. Yes, we need more nursing home beds. But can we afford to wait 5 to 10 years for these to materialize, even if they materialize ever? I don't think they're going to materialize. I think with the incoming of more immigrants, especially at the senior level, our need for the nursing home is likely to increase. And the worst is this so-called family reunion, where parents and the grandparents come and add to the burden. This is really bad. And that is to be addressed. So it's not one problem, it's a combination of problems. And that combination of problems creates havoc. A crowded emergency room is dangerous. It's not safe. It's a killing ground for your sick and elderly grannies and grandparents. And the government treats it merely as an inconvenience. It's not an inconvenience. It can be fatal. And they are waiting for a system reform that will never come possibly. System reforms don't happen overnight. It's a continuous process. And we have not even initiated the process of reforming the system. Our system is decayed. It has outlived its utility and relevance. But who cares? It's the people who are suffering. I myself have seen, when last year I was admitted to the ER for 13 hours. We were waiting, and then we were put on a bed, and 2 hours I was sent to hospice to die because the doctors couldn't do anything. That's another thing I left against the medical advice. But then a crowded ER, I'm not talking only of nursing care and the Medicare. Doctors are excellent, nurses are excellent, but the environment is not safe. It's a killing ground, as I said, for the patient. And not only does it expose the patients to incalculable suffering, indignity, but leads to increased risk of medical harm. And that can also cause death. As a matter of fact, the incidence of the deaths in the ER or because of the ERs is increasing every day. A study has been done, very recently, that 22 million patients visit Ontario emergency departments, and this study was covered 22 million people. And it was found that the risk of death of the hospital readmission increased incrementally with a degree of crowding at the time the patient arrived. So patient arrives is one thing, there's another patient waiting who has an infectious disease. That triad should segregate these patients from contagious and infectious diseases to the other patients. But that's not done. All are asked to wait in the same waiting hall. So naturally, infection and contagion increases the risk. And the estimate of the result was that the average length of stay in emergency was less than 1 hour. 150 Ontarians would die each year just with 1 hour increase. And if it's normal 7 to 8 hours wait, you can well imagine. Now leave death aside. Death may be a deliverance to many people, but the crowded ERs lead to delayed access to life-saving interventions, infection outbreaks. You remember what happens at the time of SARS epidemic. And not only that, it increases the risk of the wrong diagnosis, medical error, delirium, and the patients can go without proper assessment. And the hospital costs and the system gridlock, that leads to the ambulance waiting for interminable hours to offload patients. You can see the ambulance comes, the patient is on the gurney and keeps on waiting for hours. So if there's another patient who is sick and he needs ambulatory care, he cannot be attended to. And the result is there is inability to transfer the sick and the injured to the university hospital from outlying rural areas. Now, Toronto has 4 great hospitals, the university hospital. But can a person, say, living in Stratford, ever hope to get there in time? During my illness, I had discussions with the doctors, and a very seasoned emergency physician at one of the hospitals told me that the situation was as worse it has been for the last almost 40 years, but now with an increase in population, it has increased as well. 80 patients at times can be seen in hospitals, that's he admitted, in the waiting room, 80 patients, and 20 patients waiting on the ramp to offload the patient. And he said that when he saw this, he knew that Ontario ERs are leading the patients not to recovery, but to the grave. And then, what's the response of the government? Several committees have been formed to study the problem, and there's no result. The point is, can the safety of the patient be guaranteed in an Ontario emergency department? No. And if Medicare cannot guarantee safety, how can it guarantee recovery? As I said, they're the breeding grounds of the jumps. And it's time, that the federal government does something or the provincial government does something. You have to stop this hallway medicine system. I call it a hallway because the patients either get sick and die, or they get sick and leave, or somebody treats them in the hallway itself, which is wrong. Especially for the emergency patients who come on the ambulances, they are treated there only. Till such time you can give a meaningful ER service. It's better not to have ER. Just free up some beds. Keep Ontarians safe. Roughly 7,000 prescriptions of the products available in India. Sorry, in Canada and Ontario. Only 1,800 are shorted. So along with the ER not being there, the shortage of the drug is another problem. And the recent drug shortages range from cancer to surgical drugs to drugs for the blood pressure, seizure, heartburn, and acne. So this is a situation, and I fail to understand why the elections are not fought for this purpose. Why can our politicians not make it a prime issue? And why does the public not consider that? They go to the emergency, they come back sullen, angry, annoyed. They talk with each other. A couple of times they might write a letter to the editor and then forget about it till their next visit. In case they don't suffer much more. So Canadians and the Ontarians have got to see that first, we saw cleanliness. Let the emergency rooms be clean of the infections, of the germs, of the long waits. Otherwise, either have more urgent care centers or ensure that the hallway treatments are converted into proper treatment. Increase the beds. It should be a first priority. Decrease something else if you don't have the money for that. Stop immigration if the need is there. First, let the citizens who are here have the proper services. Why do we run after those things which should not be there? We are adding to our burden. You know, it sounds very harsh when I say stop the immigration today, what Bernier says, but not from his point of view, not from the racist point of view, but from the point of view of providing services. Your highways are blocked and your human body is, the blood circulation is blocked. Your emergency rooms are a blot on the name of Medicare. Do something. Until that time, don't give people a false idea that everything is hunky-dory. There is really a veritable heaven on earth. It is not. It is a hell on earth. And we are not doing anything. We are absolutely dumb, deaf, mute over the most important problem. And that's the tragedy of people who are quiet, who don't voice their concerns. Think about it. Thank you.